Hi, I am Dr. Sharda Ramdas, Professor in the Department of Food Service Management and Dietetics in Avinash Lingam University, Coimbatore. In the last session, we learnt lifestyle and obesity. Today, we will see if the person are obese, in what way they will be affected. So, after going through this module on complications in obesity, you will be able to understand the meaning of obesity, explore the causes contributing to obesity, and gain knowledge on health problems associated with obesity. What is obesity? Obesity is a chronic health problem. Body mass index is an indicator of the amount of excess body fat that individuals hold and is widely used to assess overweight and obesity in individuals. It is calculated by dividing a person's weight in kilograms by the square of an individual's height in meters. What causes obesity? Obesity is caused by eating more calories than you burn in daily activities and exercise. Over the time, these extra calories add up, making you gain weight. Common causes of obesity include poor diet of foods high in fat and calories, sedentary or inactive lifestyle, inadequate sleep which can lead to hormonal changes and feel more hungry or crave certain high calorie foods. Genetic also plays an important role for obese. Next, as you grow older, there will be less muscle mass and a lower metabolism, making it easier to gain weight. If you gain weight during pregnancy, it is difficult to lose and may eventually lead to obesity. Medications such as steroids and certain antidepressants or birth control pills can also put you at greater risk for weight gain. Certain medical conditions may also lead to weight gain. They include polycystic ovary syndrome, a condition that causes an imbalance of female reproductive hormones. Prader-Willi syndrome, a rare condition that an individual is born with which causes excessive hunger. Cushing's syndrome, a condition caused by having an excessive amount of the hormone cortisol in your system. Hypothyroidism, underactive thyroid, a condition in which the thyroid gland does not produce enough of certain important hormones. Arthritis and other conditions that cause pain that may lead to inactivity. A complex mix of genetic, environmental and psychological factors can increase a person's risk for obesity. Thus, the main causes of obesity are poor diet, sedentary, inactive lifestyle, inadequate sleep, genetics, aging, weight gain during pregnancy and medications. Obesity causes problems with your body, your metabolism and your mental health. Let us discuss some of the problems caused by obesity. Having a high ratio of body fat to muscle puts strain on your bones as well as your internal organs. Obesity has been linked to a number of health complications, some of which are life-threatening. Some of the day-to-day problems that can be caused by obesity includes breathlessness, increased sweating, snoring, difficulty doing physical activity, feeling very tired, joint and back pain, low confidence and self-esteem, feeling isolated and depression. Obesity increases the risk of developing a number of serious health problems. Type 2 diabetes, a condition that causes person's blood sugar level to become too high, high blood pressure, elevated cholesterol, that is hypercholesterolemia, and atherosclerosis, where fatty deposits narrow your arteries, which can lead to coronary heart disease and stroke. Breathing problem, metabolic syndrome, a combination of diabetes, high blood pressure and obesity. Cancer, including bowel cancer, breast cancer and womb cancer. Gastroesophageal reflux disease, where stomach acid leaks out of the stomach and into the esophagus. Gallstone, small stones usually made of cholesterol that form in the gallbladder. Reduced fertility, osteoarthritis, a condition involving pain and stiffness in your joints. Sleep problem, that is sleep apnea, a condition that causes interrupted breathing during sleep. Next, liver disease and kidney disease. If a female is obese, pregnancy complications may also be seen. Should we not know the risk of type 2 diabetes among obese? Obesity increases the risk of type 2 diabetes in adults. If BMI is more than 35, up to 93-fold in women and up to 42-fold in males. With the significant increase in childhood obesity, up to 40% depending on ethnicity now have type 2 diabetes. If the weight is gained during childhood, family history of diabetes, abdominal obesity, or mother having had gestational diabetes, the risk of getting type 2 diabetes is highest. Although both diabetes and obesity risk factors are often associated with race, age, and family history, it is becoming more and more clear that the conveniences of modern life also contribute to the development of both disorders. Understanding what causes the disease will hopefully allow us to prevent diabetes in the future. Being overweight places extra stress on the body in a variety of ways, including the body's ability to maintain proper blood glucose levels. In fact, being overweight can cause the body to become resistant to insulin. If one already have diabetes, this means one will need to take even more insulin to get sugar into your cells. And if they don't have diabetes, their prolonged effects of insulin resistance can eventually develop the disease. Weight gain is common in people who take insulin to treat diabetes. That is because the more insulin one uses to maintain the blood glucose level, the more glucose is absorbed into the cells rather than eliminated by the body. The absorbed glucose is stored as fat, which leads to weight gain. Of course, that's just one of the links between insulin and weight gain. In the majority of obesity individuals with type 2 diabetes, reducing body weight by 10% can eliminate or reduce the need for oral medications or insulin injections. Next, let us see high blood pressure among obese. One of the most common complications of obesity is hypertension or high blood pressure. Around 30% of individuals who are overweight have at least mildly elevated blood pressure. The etiology of this increase in blood pressure appears to be related to substances produced by adipose fat tissue and to the increase in the hormone insulin that occurs with obesity. Generally, obese individuals with hypertension should first be treated with dietary methods. Use lifestyle changes with rate reduction maintaining BMI 18.5 to 24.5 kg per milligram squared. DASH diet, that is eating fruits, vegetables and low fat dairy products with reduced content of saturated and total fat. Increase the intake of EPA, that is eicosapenoic acid and especially docosahexaenoic acid. A decrease in dietary sodium, that is 2.4 gram sodium or 6 gram sodium chloride. An increase in physical activity for 30 minutes per day and moderate consumption of alcohol. However, weight loss is the most important step in reducing hypertension and improving the quality of life. Next, we shall see the risk of elevated cholesterol or hypercholesterolemia, commonly associated with obesity. On average, every 10 pounds of excess fat produces 10 milligram of cholesterol per day. Cholesterol levels are determined by both genetics and diet. 2/3 of cholesterol level is genetically determined, while the remaining 1/3 is related to diet. People with a high body mass index tend to have a lower levels of good HDL and higher levels of bad LDL cholesterol and triglycerides than people of normal weight. One study found that for every kilogram of weight a person loses, they may be able to raise their HDL by 0.35 milligram DL. Most people can improve or control their cholesterol by reducing both their fat intake as well as weight. In obesity, heart disease is a problem. If overweight, one may develop hypertension, diabetes and atherosclerosis. These conditions will put one at high risk of cardiovascular disease. One can tell if one is obese by the size of the waist, the ratio of waist to hips and the relationship between height and weight known as the body mass index BMI. As BMI increases, so does the risk of heart disease and stroke. Previously, it was thought that fat was inert. Now, scientists understand that fat, especially intra-abdominal fat, the person with the big belly, has significant impact on the metabolism. This fat affects blood pressure, blood lipid levels and interferes with ability to use insulin effectively. Although most of the comorbidities relating obesity to coronary artery diseases increase as BMI increases, they also relate to body fat distribution. Next, heart attacks and strokes. There is an increased incidence of the stroke and heart attacks in obese individuals. This increase is both independent of and additive to the increased risk associated with the elevated blood pressure, type 2 diabetes and elevated cholesterol frequently associated with obesity. This increased risk appears to be partially related to substances produced by adipose tissue that make it easier for blood clots to form. Overall, obesity results in premature death. The obesity paradox suggests that overweight and even obese people may have a lower risk of dying prematurely from a number of conditions, including stroke, than do normal weight folks. The study found that people who were overweight or obese were at least several years younger on average when they had a stroke than people who were a normal weight. Stroke patients who are obese or overweight did not survive better than stroke patients who had normal weight. A new study by Columbia researchers indicate that people with the abdominal obesity are at higher risk of ischemic stroke, the most common type of stroke caused by blockage or constriction of a blood vessel in the brain. To achieve a more precise measurement of obesity, the researchers in this study used abdominal obesity measures based on a ratio of waist circumference to hip circumference. Next, breathing problem. Asthma is more common as BMI goes up. Excess belly fat is strongly associated with impaired lung function. Researchers analyzed information from more than 1,20,000 people and found that the larger a person's waist size, the smaller their forced vital capacity, the maximum volume of air that a person can exhale after breathing in as much air as possible. Women and men with abdominal obesity were twice as likely as those with a normal waist size to have a low forced vital capacity. The association between waist size and lung function was seen even in people of normal weight. Excess belly fat may affect breathing by pushing on the diaphragm and chest wall, making it harder for the lungs to fill with air. The American Heart Association considers waist circumference of more than 35 inches for women or 40 inches for men to be abnormal. For people of Asian descent, waist circumferences should be less than 31 inches for women and less than 37 inches for men. The next problem in obese is metabolic syndrome. It is commonly found in the obese population with over 47 million Americans, that is 22% of the American population are affected by this metabolic syndrome. To be diagnosed with metabolic syndrome, you need to check for waist circumference, triglycerides, HDL cholesterol, blood pressure and fasting glucose level. The most effective treatment of metabolic syndrome is weight reduction. Alternatively, the individual conditions are treated with multiple medications. Next, cancer. Obesity also results in an increased risk of cancer. In females, there is up to a threshold increase in the incidence of breast, uterine, cervical and ovarian cancer. The risk of endometrial cancer, that is cancer of the inside lining of the uterus, is up to 7 times higher. For men, there is an increased incidence of colon and prostate cancer. The World Health Organization, the International Agency for Research in Cancer, has estimated that being overweight and also sedentary might account for up to 25 to 30% of cancers of the breast, colon, uterus and kidney and esophagus. Several possible mechanisms have been suggested to explain the association of obesity with increased risk of certain cancers. Fat tissue produces excess amount of estrogen, high levels of risk of breast, endometrial and some other cancers. Obese people often have increased level of insulin and insulin like growth factor 1 in their blood or insulin resistance, which may promote the development of certain tumors. Fat cells produce hormones called adipokines that may stimulate or inhibit cell growth. For example, leptin, which is more abundant in obese people, seems to promote cell proliferation, whereas adiponectin, which is less abundant in obese people, may have anti-proliferative effects. Fat cells may also have direct and indirect effects on other tumor growth regulators. Obese people often have chronic low level or subacute inflammation, which has been associated with increased cancer risk. Other possible mechanisms include altered immune responses, effect on the nuclear factor kappa beta system and oxidative stress. Does avoiding weight gain or losing weight decrease the risk of cancer? If every adult reduced the BMI by 1%, which would be equivalent to a weight loss of roughly 1 kg for an adult of average weight, this would prevent the increase in the number of cancer cases. Nevertheless, many observational studies have shown that people who have a lower weight gain during adulthood have a lower risk of colon cancer, breast cancer after menopause and endometrial cancer. Obese people who have bariatric surgery appear to have lower rates of obesity related cancer than obese people who did not have bariatric surgery. It is important to note that most lifestyle weight loss interventions result in weight losses of 7 to 10% of body weight, whereas weight loss from bariatric surgery combined with lifestyle changes generally result in weight loss of 30%. Next, gallstones. Obesity is frequently complicated by gallstones. Approximately 25% of obese individuals have gallstones, often resulting in surgery. The increase in cholesterol that results from obesity is one of the major reasons for the increased incidence of gallstones. People who are overweight have more cholesterol in their bile, and gallstones are really deposits of cholesterol. The more cholesterol you have in your bile, the more likely it is to form gallstones. The distribution of fat on the body may also contribute to the development of gallstones. A recent study found that men with more fat around their abdomens had a greater chance of developing problematic gallstones than those with smaller waistlines. Next, arthritis. Weight plays an important role in joint stress. So, when people are very overweight, it puts stress on their joints, especially their weight bearing joints like the knees and the hips. Every kilogram of excess weight exerts about 2.5 kilogram of extra pressure on the knees. Obesity is frequently complicated by degenerative arthritis, the wear and tear form, more formally known as osteoarthritis. Increased weight causes more wear and tear on the joints. Adipose tissue also produces substances, cytokines, that destroy the normal cartilage in joints. If a person loses weight, the wear and tear gradually diminishes and the amount of cytokines released from adipose tissue diminishes. The arthritic destruction of joints that has occurred over the years does not disappear. However, the joint pain will generally diminish since there is less stress and destruction of the joints. Next, sleep disorders. Problem with sleep may be indicative of a more severe condition referred to as sleep apnea. In adults, the most common cause of obstructive sleep apnea is excess weight and obesity, which is associated with soft tissue of the mouth and throat. During sleep, when throat and tongue muscles are more relaxed, this soft tissue can cause the airway to become blocked. For people with this problem, it becomes progressively more difficult to breathe, especially at night, so snore severely and have episodes when they stop breathing completely, sometimes for up to 1 minute at a time. During these apneic, not breathing periods, the amount of oxygen in the blood drops. As a result, heart may beat irregularly. These individuals may fall asleep while sitting in meetings or driving. Weight reduction is an effective treatment for sleep apnea. However, specialized equipment and masks that prevent the airways from collapsing, improving respirations are usually used to prevent the irregular heart rhythms that frequently occur with this condition. Next, fatty liver. It is caused by excessive fat deposition in the liver. Almost all heavy drinkers develop this condition, but it is climbing quickly among non-drinkers too, especially among people who are overweight or have type 2 diabetes. When it occurs in moderate or non-drinkers, we call it non-alcoholic fatty liver disease, that is non-alcoholic steatohepatitis. In short form, it is termed as NASH. Excess calorie consumption can lead to excess fat intake, with the fat being stored not only in fat stores but also in the liver and other vital organs. This excess liver fat results in silent inflammation, usually detected by abnormal liver function test when a blood panel is performed. It is estimated that 10 to 20% of individuals with the condition, if untreated, will go on to develop cirrhosis or liver failure during their lifetime. Next, kidney disease. Being obese also can affect kidney function. The kidney cannot filter well in people with chronic obesity. So, kidney function is decreased by having excess weight alone. Next, infertility. Most obese women are not infertile. However, obese women are 3 times more likely to suffer infertility than women with a normal body mass index. In women, 6% of those who are obese have trouble in conceiving. When a pregnancy occurs, the chances of hospitalization is 4 to 7 times greater for a woman with obesity compared to a woman who is lean. Gestational diabetes, difficulty with blood pressure, that is preeclampsia, difficulties while in labor and delivery, higher C-section rates and more deaths of the mother or fetus are all associated with obesity. Children born to mothers who have obesity are more likely to be large. Large birth weight increases the risk of infants developing diabetes in later life. Men are also affected by obesity. Obesity causes impotence and lower fertility. Many men have low testosterone, that is the male hormone, because they have excess abdominal fat. Obesity impairs fertility through an effect upon the control of ovulation, oocyte development, embryo development, endometrial development, implantation and pregnancy loss. So, to conclude, obesity is an increasingly prevalent health burden upon modern society. Being obese increases the risk of many potentially serious health conditions. Obesity may also take an emotional toll. Some people with obesity experience depression, feelings of social isolation, discrimination and overall lower quality of life. Obesity reduces life expectancy by an average of 3 to 10 years depending on how severe the problem is. Weight management, which generally improves these complications of medical comorbidities, requires long-term intervention to achieve long-term results. Bye to all the listeners.